Good afternoon. Welcome back to UCSF Department of Medicine Grand Rounds. I'm Bob Wachter, Chair of the Department of Medicine. Welcome to our live audience from the department, from throughout UCSF, the UCSF Health System, and our UCSF Health Network. As usual, we will post this at about 7:30 tonight on YouTube. I will try to tweet out a summary and the web address at that time. And our previous Grand Rounds are up to about 1.1 million views, which is quite wonderful. A few ground rules are here on the screen. Put your Zoom window in full screen mode. If you have questions, type them in the Q&A box. We will try to get to it. And for the first time, we now have closed captioning that's available to you. There's a button at the bottom of your Zoom screen for this. Let us acknowledge today that everybody's pretty stressed out by all things 2020. And now we have the election results on top of that. So here from Twitter, I'd like to show you my new stress scale. There you go. And for your information, I'm currently at a Fauci 1.7. And I don't know where you all are, and this is subject to change on a moment's notice, depending on the election results. There are many lessons that we've all learned over the past 8 months, but perhaps the most important is that science and politics cannot be fully separated. One of our guests at these Grand Rounds a few months ago was John Barry, author of The Great Influenza, a really terrific book about the 1918 flu pandemic. And John wrote this piece in the New York Times in July, and the opening quote, I think, captures an essential truth that we will really be talking about today. And John wrote, "When you mix science and politics, you get politics." And clearly, what we've seen over the last 8 or 9 months is that you cannot separate the science and politics, particularly in the current era, and that really is going to be today's topic. Yesterday's news, of course, was the election, but it was also a day you may not have noticed with all the election news, but it was a day in which we had 100,000 new cases and more than 1,000 deaths from COVID. So there's a lot to talk about as we talk about the confluence of the election, the healthcare system, and COVID, and that is what we plan to do today. Given the quality of our speakers, I'm excited about this and want to get to it quickly. These are 3 of the most insightful people I know to help us make sense of the election, what it means for COVID and healthcare. We won't spend all that much time on general election punditry, since unless you haven't paid your Comcast bill, you've undoubtedly had your fill. And we do need to acknowledge that the outcome of the election remains mildly uncertain, at least as of 2 minutes ago. For our purposes, we will tend to go with the guiding assumptions that Biden will win the presidency, although that is not certain, and that the Republicans will hold the Senate, although that too is not certain. Our 3 guests today are Kirsten Bibbins-Domingo, who's chair of our Department of Epidemiology and Biostatistics and Vice Dean for Population Health and Health Equity in the UCSF School of Medicine. She co-founded the UCSF Center for Vulnerable Populations and is a former chair of the U.S. Preventive Services Task Force. During COVID, she has been a leader, particularly in highlighting issues surrounding health equity. I'm thrilled to have 2 non-UCSF folks join us, and they're 2 of my heroes. Ezekiel Emanuel is the Vice Provost for Global Initiatives and co-director of the Healthcare Transformation Institute at the University of Pennsylvania, my old alma mater. From 2009 to 11, he served as special advisor on health policy to the Obama administration. He's published over 300 articles, authored or edited 15 books, including the terrific 2000 book, Which Country Has the World's Best Healthcare? During the pandemic, he has been a constant presence in the media and has published many important articles in both the lay and professional literature. Our other guest is Andy Slavitt. Andy began his career as a healthcare consultant and senior executive, and then entered public service, rising to become the director of the Center for Medicare and Medicaid Services in the Obama administration, where he managed a $1 trillion budget, which it sounds like real money, and was a key leader in the implementation of the Affordable Care Act. During COVID, he's been a highly effective spokesperson for an empathic and science-based approach through scores, probably hundreds of media appearances. His In the Bubble podcast, highly recommended, and his frequent tweets to over 600,000 followers. His upcoming book, which is called Preventive, the inside story of how leadership failures, politics, and selfishness doomed the U.S. coronavirus response, will be published in a few months, but is available for pre-order now, and I have done that. So thank you all for being here. It's really a joy to have you and on this kind of momentous time. in health and healthcare and for our country. So let me start with a first question about the election generally. And let's start with a general takeaway that you have from the election, an observation, a deep truth that the election has proven to you. And if you can, try to do something that you have not heard other people say. Assume that we have all been watching constant coverage. And for both Andy and Zeke, you've been part of what we've been watching for the last several days. So it's something that you have observed that you don't think you've heard as much about as we should have. Kirsten, why don't we start with you?
Sure. I think this relates to our topic today. I think a common narrative that I hear is that, wow, the election wasn't really about COVID, and it's amazing how people voted against their public health interests and instead voted for the economy. And unfortunately, I think that is misses how much the economy and the pandemic are intertwined, how much aspects that we're talking about in disparities are about socioeconomic disparities, how the communities that are devastated by the pandemic are devastated by the economic crisis. And I think our tendency to fall into these polarized dichotomies is not helpful for either. And what I hope when we move forward is that we can start to think of them together.
Great. I'm sure we'll return to that theme. Zeke.
I think the most interesting thing, and it's not just this election, but this election certainly amplified it, is ballot initiatives are important, work, and you can take ballot initiatives in red states and get blue results. So, in Florida, the President Trump won by 3.4%. And yet 60% of the population voted to increase the minimum wage to $15 from what's currently $8.65. Now, California is the exception to this actually in the current moment. But if you go around the country, we've had ballot initiatives about Medicaid expansion in the reddest of red states, whether it's Idaho or Utah, Missouri, Oklahoma, and they've passed. You've had a lot of other liberal initiatives pass in red states. And I think, you're not going to win every ballot initiative, but if you focus on the right ballot initiatives, minimum wage, Medicaid expansion, probably anti-gerrymandering and allowing felons to vote, which passed in California, but it also passed in Florida in 2018. I think that there's a pool of ballot initiatives that can get through even red states that move the country in a more humane direction.
And what does that disconnect say to you?
That people on particular issues, you can get bipartisan majorities, whereas voting for politicians tends to be more polarized. And I do think you see that in what people say. They want people to come together, and yet when they vote, they're voting polarized. And that's partially because the politicians are polarized and you don't have a choice of the compromise candidate by the time it gets to the general election. And so I do think, there's probably 4 or 5 issues like minimum wage, like Medicaid expansion, like voting, where I do think there's a lot of overlap and agreement, and we probably can get advanced agendas on it.
Great. Andy.
I think part of what's going on is Democrat and Republican probably officially now don't mean what they used to mean. Obviously, it's been trending for a while, but I think we now look more like Europe, where one party is where right means anti-immigration, it means populist, it means kind of Berlusconi-esque, and you could name others. And that's officially, I think, the party of the right, and the party of the left is kind of the global worldview. And so because the party of the right is now, I think Trump succeeded in ways that I don't think people understood over the last 4 years in making those views mainstream. And the party of the fiscal hawks, that's gone. The party of the military hawks, that's gone. And so you pick up on Zeke's point, minimum wage, that's a populist issue. I mean, that's not necessarily what's going to be the issues that separate us anymore. So I think there's a reshuffling. And this reshuffling is, you can explain why people would quote unquote vote against their best interests by understanding that those become broad categories of identity now. So people are going to pick through issues quite as much. You believe in, and there are certainly exceptions, but if you believe in a certain worldview, a certain way of life, a certain attitude towards immigration, for example, that is who you are, that is your tribe. That is a very different place than what our two parties meant going back for a long, long, long time.
And is there something about that people are, as you're describing what the Democratic Party then means, and it sounds fairly traditionalist and incremental, and the other one sounds more exciting, even if you don't like the agenda. Is there something about that people want to just break up the China shop, and they find something attractive about the Republican Party in saying that?
Well, I think the implication is that the Democratic Party is not the party of union worker anymore. It's more an educated party. It's more of an institutionalist party, a believer in science, et cetera. Again, if you carry this out to where you see things are in Europe, again, I'm not saying we're necessarily all the way there today, but if in effect the Republican Party comes back in January in the Congress, and you could expect them to no longer were they toying with Trumpism or kind of straddling or apologizing, but that is their base now, and that is there is vote. And I'm trying not to say inflammatory things like racism and other things which are obviously come to mind, because I'm trying to describe it in in neutral terms. But we know that underlying all that are our worldviews that are quite different from one another.
Yeah. Kirsten, I sort of can't help but raise the issue of racism, and how did you interpret the vote in light of the issues of race that have been an undercurrent, and maybe more than an undercurrent, over the last year?
Yeah, I think that if you look particularly at the rise of younger people voting, the overwhelming drive of non-white younger people towards the Democratic Party, I think you have to look at that in the face of what was very clear racist, polarizing, anti-immigrant messages coming from the federal government. I think that those pieces of it, I think, are interesting in light of the diversity that will continue to be part of our demographics in the U.S. And so I think that piece of younger people coming out to vote, diverse young people coming out to vote and voting overwhelmingly for rejecting this message that's coming from the current government, I think is important. It is my concern that that the polarization that has been part of the scientific message has really both devastated the communities that are disproportionately affected by our pandemic, but also has harmed our overall pandemic response, because we can't get past that to have people to think in more of a public health collective mindset, because every single thing is polarized by racism and other issues there.
Yeah. So let's turn a little bit to healthcare and the politics. So I know, Zeke, you've been in touch with and been a key advisor to Vice President Biden. What do you think his group is thinking about, particularly during the transition? It strikes me the next 2 months is just got to be an incredibly wild time. You don't control, assuming he wins, you don't control the levers of power yet. You sort of have a new bully pulpit. You're signaling a whole lot of stuff that you will do come January, but you can't do it yet, really. You're competing on message against an existing administration. So how does he lay out the next month or so in a way that sets him up for success and gets us moving in the right direction? Obviously, this is all at a time that the virus is going wild.
Well, you're right, Bob. You want to hit the ground running on January 20th and be ready to push things forward. We probably are at a slightly and will be at a slightly different place than many people anticipated. There's no vaccine yet. There may or may not be a vaccine available. There are a number of places where we know there are big challenges, whether it's testing, making sure we have enough PPE, contact tracing, and then the distribution and administration of any vaccine that comes along. All of those have to be ready. There's also the issue of rebuilding, as it were, the CDC and the scientific integrity of the public health response. And I think all of those are going to be top of the agenda. On the other hand, as you point out, the president-elect is not the president and cannot actually do anything. And so I think, this reminds me, fancy myself a student of presidential history, and probably any historian reading will say, well, you are a student and you should, keep that in mind. But, this crisis is reminiscent of Obama taking over in 2009 and also FDR taking over in 33. And, Hoover kept trying to get FDR to come in and share responsibility for decisions made in that transition. And by the way, in 33, the transition went all the way till March 5th. And Roosevelt resisted being co-opted into making decisions and taking responsibility for decisions that Hoover would make. And when he took over, immediately declared a bank holiday. And Hoover just didn't do anything. Similarly, when Obama took over, there was a lot of preparation for what should be in a stimulus bill? How big should that stimulus bill be? So there was preparation on what to do on the day and be sure that you're ready for that day. And I think the same thing, the Biden team will do the same thing, preparation for that day in all these areas that need to be addressed. And I think you're going to see, movement in that direction. Who's going to head the CDC? Who's going to head the NIH, the HHS, and things like that.
Let me push back on that slightly, because it strikes me as a difference. There are a lot of similarities between the economic crisis and, whether it was the Great Recession or the Great Depression. But in some ways, the difference is the importance of the bully pulpit and the messaging on things as simple as masks, where you don't necessarily need the levers of power to be a leader saying everybody should wear a mask.
Well, Bob, but I'm sorry to interrupt you.
Oh, go ahead.
But Joe Biden's already doing that.
Sure,
right?
But
how
vigorously does he try to create a competing narrative and be out there very visibly doing that, or does he kind of lay low and say, "I'm preparing for my moment on January 20th"?
You're asking a doctor, health policy nerd, not a communications expert. But I think he continues to do what he does and what comes naturally, which is he's adhering to all the public health measures, small groups, wearing a mask at all times, hand hygiene, 6 feet distant. And I think he's going to continue to do that. I don't think he's going to hog, it's not Joe Biden's nature to go out there and hog the microphone. But it is his nature to embody the proper public health measures. He's been doing that for months, and he will continue to do that. And I think it doesn't behoove anyone to get into a fight with the president over this. The people voted for him, and he will do, and Kamala Harris and anyone he appoints will adhere to these measures. That's who they are. And I don't think it's a calculated kind of thing for them, as best as I can tell.
Yeah. Andy, I know you've advised the team as well. What kind of advice is he getting? And what do you think, if he is going to sort of do something big on January 20th, what does that look like?
Well, look, you've got 4 levers of power, basically, at the federal government. You've got the ability to do executive orders and kind of operating action, which I think Trump, there's lots of opportunity for. So I think he'll get ready executive orders that will help us accelerate testing, that will help us produce more PPE, that will help us just run this thing better. The second tool you need Congress for, and that's money. You will not arrest this pandemic until people have things like paid medical leave, until you have a safety net and other support for people. So that's something he's going to have to get ready, and he's going to have to work with Mitch McConnell on and try to craft something. And that's not going to be easy, but Biden he's sort of cut from that cloth. He knows how the Senate works, and he'll try to get something done. The third thing Zeke's talked about, so I won't mention it, is the science. And he has been thinking about that for a long time. So he will not be starting from 0 miles per hour. The fourth thing is, I think, the thing that's most at issue, and it's the most challenging thing, and that is the bully pulpit. And the truth is, until we have a reliable vaccine, and even after we have one, our communication with one another is our medicine. How we talk to each other, how we communicate, how we decide what values are important to us. People are exporting a lot of sickness and death to other communities. They're links in a chain that are concentrating this in places where people aren't paying attention. And so we've lost a sense of unity. We've lost a sense of empathy. We've got this sort of fetish with freedom and rights and all these other things. And, how do you as a president come in a way that's even probably more divided than you anticipate, and start to calm the waters and start to try to get people onto the same page? Because, we've done some analysis which shows that for every 10% more of the population that's non-compliant, you have is 100,000 more deaths, roughly speaking, rule of thumb. So, how you do that in a moment like this is incredibly tricky. I would probably lean in hard to this, even during the transition. If I were him, I would be getting together with governors and with others, and I would be doing listening tours. I would go out to communities that are non-compliant with mask wear and so forth, and I would start to lay the seeds, the listen, to get it to be in touch, because this is not a straightforward task. Mandating a mask. This is something that you have to sell to the public. This is our first. Remember, this is our first time here as a country. We're not doing it well, but other countries have been here many, many, many times before and have done it and know how to do it better. So we have to kind of teach ourselves how. And you need a leader who's willing to try to do that.
So we're starting this, at 10 months into a pandemic where the very issues of mask wearing have been politicized and polarized. And I agree with you that we have to, that this is the strongest weapon that the new president will have. But it will be a real uphill climb to get there and to do that. And the anti-masking sentiment is so strongly aligned then with the anti-vaxxing sentiment in many circles. It is something that has really been taken many of our great public health officers in states across the country out of their jobs because of this really virulent protests against masking. And I think if we can get the states and the leaders within states to do this, it's going to be essential. But it'll be hard. And remember, January is in the middle of winter. We're already entering a time of the pandemic where everyone is expecting more cases, more deaths, and we won't have a new president until January in the middle of.
That's right.
So let me make 2 points. Go ahead, Andy.
Andy, finish up, and then Zeke.
He's being dealt a tough hand. You're exactly right. The kind of fatigue, so to speak, that it would have been much easier to do this early. The fact that it's not just I don't believe in wearing a mask. The fact that it's a political statement now, as you said, Kirsten, and we did not have to be there. Trump chose to add that fuel to the fire. So he's got a very difficult hand to play there. But he doesn't have a lot of choices. By the way, it's not just him. I got a call from Mike DeWine, governor of Ohio, Republican. They have a mask mandate. And he tells me Cincinnati, Columbus, Cleveland, they're holding their own. They're doing okay. But the rural communities, house parties, it's like that in Minnesota where I am. It's like that in California. It's like that all over. And he's trying to figure out how to address this challenge. And he just got scalded because he yelled about a super spreader wedding in a rural community. And so he's like, oh my God, what do I do? And at this point, it's important to know that we're not debating the merits of the science very much anymore. We're debating the sociology of this thing. And that's where we've got to play this game to win.
Well, sociology and the politics. Yeah, go ahead, Zeke.
Yeah, I would say part of what I think is important is changing the narrative here that, it's freedom not to wear a mask, it's freedom to infect other people, and point out and make a contrast between wearing a mask and enhancing freedom. Because if you look at places that have been wearing masks and have succeeded in getting transmission rates incredibly low, under 1 per 100,000 population, places like Taiwan, South Korea, Japan, China, they have more freedom than we do. It's just a simple fact. They have daily life. I talk to people I know in Beijing. It's normal, right? Life is normal there. It's anything but normal here. And I think changing that narrative so that freedom is associated with a temporary necessity of these measures and laying out for the population what is going to be expected of them and what we can expect over the timeline, I think is going to be very important to do. That's something the president has never done. He's never been Churchillian in that way. And I think you will see, that's an approach you absolutely need to have. The second thing I do think has to be out there front and center, and commentators like Andy need to make clear, and I think, sort of hinted at, with the combination of Thanksgiving, which inevitably people are going to get together no matter what the scientific experts say, and then compounded, 5 weeks later by Christmas, you are going to have a big spike beginning around Christmas time, going through the end of January. It is inevitable. And I think preparing people for that, how do we come down from that spike? By the way, same kind of spike happened in 1919 after the first wave in 1918, that winter, big spike up. And I think prepping people and telling them what to expect, because, we're wired that if I'm not seeing a big increase now, I don't think it's here. No, it's here. You're just not seeing it. You will see it in 2, 4, 6 weeks from now. And that is a sort of logic that I don't think people have caught on to yet. And I think it's going to be critical for people to understand it's maybe low now, it'll go up. And if you wear a mask and do these public health measures, you will actually get more freedom. And this is how it's going to look. And I think that's going to be a critical element of the communication strategy.
I think it would have been the perfect communication from the start. I think it's a challenge to start that now. That's the big problem for anyone.
Look, I agree with you, but I think there's a reason that Biden won on this.
Zeke, let me ask you to do something truly impossible, which is to put yourself in the shoes of a Republican legislator and a Republican governor today, and just approach from a political standpoint. Now the dust is settling. Let's assume that Biden wins. They kept the Senate. They picked up some House seats there. You could paint this as they did better than they thought they'd do. Just in terms of realpolitik, what do you think their incentive system is in terms of cooperating with Biden on some of the initiatives that Andy mentioned? We've got to get through a relief package. We got to get through some things that really are going to require legislation. Is there any incentive to cooperate? Is there any incentive for a governor who's not Mike DeWine, but one who's been hardcore about no masking, to change his or her tune based on the new reality as they face it today? Or Trump doesn't matter, the incentive system is the same, and we're going to see obstruction and nobody's changing their mind?
I'm not the political brother, and that's a question better asked to my brother.
You're political enough, but yes, I understand.
Well, I tend to be a policy wonk who's in the political sphere, but I will let me do the next best thing, because I'm terrible at impersonating a Republican. Randy Whitlock, who was a major advisor to Grassley and is I think a super smart Republican. I asked him this question, not about 3 weeks ago. He was on a panel back at my home institution, Penn. And I asked him, well, if the Democrats win, are we going to have a chance of, if Biden takes over, are we going to have collaboration or not? And he answered me the following way. Over the last 40 years, the Republicans have had the White House most of the time. Democrats have actually had the White House and the Senate. Then he thought, having the legislature 4 years out of 40 years. Since 1980, there have been 2 periods of time that the Democrats have controlled the Senate, in addition to having the White House. The first 2 years of Clinton, the first 2 years of Obama. And he said, both ended pretty bad for the Democrats and good for the Republicans. And our approach in both was no cooperation. There will be no cooperation. And I was like, my jaw dropped, and I was like, oh boy, this is a great future to look at.
But I was on that panel with him, and I think he was saying something a little bit different. He was saying when Democrats have all 3, they will overreach, and Biden won't have the chance to do that. That was his predominant point, that Democrats will go so far to the left, in his view, that Republicans have nothing to worry about. So divided government is going to be a little bit of a different equation.
And
well, Andy, you and I heard different things then at that discussion. It may be that Democrats might have that tendency when they have all 3 to overreach, although I don't think there was a lot of overreaching in 2009, 2010, but there wasn't a lot of cooperation in neither 93, 94 or
if you're a Republican, those were 2 periods when they tried to do Hillary care and Obamacare. Neither one of us are Republicans, but that's in their view, that's all it took. So his perspective was, if Biden has all 3, he'll do something like that. Whether it's healthcare or not, he didn't say. The equation between McConnell and Biden is going to, of course, be the most interesting one, because McConnell can choose to do the same thing he did at the beginning of Obama's administration and say, you'll be a one-termer, and demonize both. And the party will spend all this time demonizing both him and Harris, by the way. And if that's the case, it's going to be very interesting. And the other problem with the Republicans is it would be easier if there was stuff they wanted. They're not going to get judges. They're not going to get a tax cut. So they want very little. And when you want very little, you can be obstructionist. It's hard for the Democrats to be obstructionist when they're in minority, because they got a list as long as their arm of things that Nancy Pelosi wants to deliver. And so they'll tend to give Republicans things in order to get some of those things. This is a situation where it's not clear what it is that the Republicans want at all. And it becomes, and I think this is where Zeke is absolutely right, it becomes easier for them to be obstructionists, and it's a better political play for them. And given now what we've just said about the divisiveness about the 2 parties, I wouldn't be optimistic.
Yeah. Let's tilt a little bit back toward not just pure COVID, but healthcare in general. Maybe start with you, Andy. What is a realistic expectation for what happens to the Affordable Care Act over the next 4 years? Or is it trying to just hold on and for dear life and not lose anything? Or do you think there's any opportunity for expansion?
Well, let's talk about the case first, because the case is next Tuesday. And we won't find out in the spring. This is, of course, Texas versus California. So look, at issue are a few things, but one of them is the justices are going to have to make a decision around severability, which is to say that if there's one word of the law that they believe is unconstitutional, do they throw the whole law out or not? Now, if I were a 48-year-old, 52-year-old justice, which is the last 2 people that were appointed, I'm not sure I'd want to set a precedent that if one part of a law is broken, you throw out the entirety of the law. That's a straitjacket. Now, it's not, from what I understand from legal scholars, the precedent of severability isn't so rigid. It's a bit expandable. So, and of course, there's nothing to say that these people have to show principle at all. But be that as it may, I think the most likely case is that if they choose to throw out the law, they'll throw out part of it. And the question is, what will it be? Would it be just the mandate, If that was just the mandate, that wouldn't be a problem. If it was the mandate and pre-existing conditions, that'd be a problem. If it was the mandate, pre-existing conditions, and exchanges, that'd be a big problem. If it was all those things plus Medicaid expansion, it'd be a big problem, a bigger problem. So, I think we're going to be, because the court likes to cut the baby, my speculation, which is uninformed by anything other than what I've just said, is that, there will be some damage done if they choose to do that. And with a Republican Senate, with a Democratic Senate, which could still happen, there's 2 runoffs in Georgia. And if the Democrats win those 2 runoffs and have the presidency, then it's an interesting scenario. They'll have 50 votes plus Harris. By the way, nobody likes to govern with 50 votes, because then every senator is the most powerful person in the country. So it's very hard to get stuff done even then. But if you did, conceptually, you could right any wrongs. If not, then you'd have to imagine throwing up everything against the wall and starting over again. And I have very little confidence that that's possible. In fact, I think the court has it's in their hands. I mean, what the court decides is very likely where we're going to end up, and that's scary.
Yeah. Zeke, you want to add anything?
Yeah, I think separate from the case, and again, I think it's unclear, and I can imagine all the scenarios, and I have a bet on a few of those scenarios. As some of the audience members may know, I like to make bets, and I like to make bets for dinners. And I do worry about this new composition of the court and its aggressiveness in overturning past precedents. But let's assume it stays, just for the sake of argument here. There's going to be no more legislation on this going, certainly in the next 2 years, unless somehow the Democrats do take the 2 seats in Georgia. And therefore, you're going to be in the situation of mostly doing regulation and CMMI demonstration projects to advance the issues. And as I mentioned, ballot initiatives in some red states. I believe in 2022, Florida's going to have a ballot initiative on Medicaid expansion. So what do those demonstration projects allow you to do? There's a lot of power, I think, in things that can be introduced that way, that reform the health delivery system. It's going to be harder to do things that are going to address the big disparities of care, and not just care, but the disparities in health outcomes, some of which can be addressed by the care issues, but a lot of which have to take the social determinants in health. There are, again, things that can be done in terms of expanding food stamps and expanding housing programs. But it's all going to be done within the confines of regulatory changes, which also do take time to introduce and implement. And so I think that's what we're left with. So there'll, assuming the Democrats don't take those 2 seats or take only one of the 2 seats in Georgia. And so I think that's where the attention and energy is going to end up going. Regulatory changes and demonstration projects.
Yeah, it also seems like, the lesson of both Clinton and Obama is healthcare is really, really hard, even if you get it through. And you've got your healthcare energy in the beginning has to be COVID, and rather than sort of grander, broader strokes, and then has to be the economy, and then climate change is higher on the agenda than it would have been, a year or 2 ago. There's just so much else that's consuming. It makes you wonder whether they'd even want to wade into that area as important as it is.
So if I could play a student of presidential politics again, just for a minute, Lyndon Johnson was maybe the most capable president in terms of legislative enactment. And in the year after he was elected in his own right, he got 4 major pieces of legislation through, and he won by 60% of the vote, super landslide against Barry Goldwater, right? He got Medicare and Medicaid. He got the immigration bill. He got the higher education bill, and he got the Voting Rights Act of 65. Now, he got a lot of other small things, but that was the core of the big push, those 4 pieces of legislation. And, even if President Biden gets the majority in the Senate, which would be fantastic, there's a limited number, as you point out. There are a couple of maybe 3 bills that you're going to be able to get passed. And so you're going to have to pick and choose your priorities very, very carefully.
Plus, no landslide, no Fox News, no Twitter, no, it was a different
absolutely.
world.
You'll have a couple of opportunities. I mean, it's funny, Zeke and I are probably both part of these conversations. A week ago, there was this debate. Should we use 2 reconciliations? Should we, blah, blah, blah. So there was a lot of strategy that's gone out the window because they don't have those available to them. They do have a couple of things, though. They have a must-pass bill in COVID. They'll have a few other must-pass bills, and those are the time that they'll use to try to get some things on them. Zeke's exactly right about executive authority. I mean, day one, the first thing you do is you basically undo all of the things that have upset trans rights, women, people of color. There's so much of that sitting around. There's so much that has been damage that's been done. I think that becomes kind of the most instant things. And then, you can do things with the ACA that are marginal, maybe a little bit more than marginal in the rules. You can certainly expand open enrollment and the way it works. You can certainly expand the money towards open enrollment. You can certainly target underserved populations. But look, a week ago, we were talking about $100 billion towards health equity for Biden Harris. We were going to attach $100 billion of health equity money and it was exciting and interesting and out the window now. So there are things you can do, but it's a different ballgame.
Yeah, well, that $100 billion may be spent on the Georgia Senate race, so we'll have to see how that goes. Kirsten, any reaction to, we've talked issues of health equity and social determinants, and that there were big ambitious plans that may need to be scaled back if the Senate stays the way it looks?
Yeah, I think, my colleagues here can describe the federal landscape. I think it's actually a really interesting time, though, because there's been so much action on the state level to think about social determinants of health and the integration of social determinants of health in the context of healthcare delivery, to think about demonstration projects. And I think COVID actually has accelerated the interest in that. And there are states, North Carolina and Oregon, other states that are doing really fascinating things. I think an environment in the federal government that allowed more of that to happen could, of course, prompt scaling of that. But I do think we have to give the states a lot of credit for a lot of innovative ideas that they have invested in, that are going forward, and I think probably have been pushed forward because of the urgency of COVID as well.
Yeah, the problem is they're all going to be broke, and so.
Well, yes, there is that.
There's that. Let me stay with you for a second in terms of equity issues and race in particular. I think there are a lot of people, I probably put myself in there, that tended to think about race as a monolith. And it's, there are issues about how we take care of minorities and disparities. And one of the things that may come out of this election is a little bit more nuanced thinking that Blacks don't approach the world the way Latinos approach the world, and the Cuban in Miami thinks differently than someone from Mexico in Texas. First of all, do you think that's right? And second of all, how does that change the kind of health and political landscape going forward, if it is right?
Yeah, when I look at the disparities and I look at the issues that have even become more pronounced during COVID, which has become commonplace to say now, COVID lays bare the disparities that have already existed. It both strikes me that the stories are incredibly local and specific to the state or specific to the individual group that we're talking about. and at the same time completely generalizable, right? There are such common and strong themes that relate to our low-wage workers for whom there are both no workplace protections, no income protections, who are feeling the brunt of our economic crisis, that the transmission in those communities is highest. Issues of transportation and crowded housing accelerate those, and that we have to think of those both collectively, but to really establish the types of trust and dialogue, we have to think of them also very locally as well. And so I do think that that is both a theme that I talked about in clinic with my colleagues this morning, because while much has been made of the heterogeneity in the Latino population, second guessing, why Black voters vote for Trump and things like that, the reality is we got out a lot of people to vote, and still these votes overwhelmingly went, in most communities of color, overwhelmingly rejected the current administration. We increased the number of people voting, so it's always going to look, it's hard to make the comparisons to the 2016 election. And I do think there is a need for us to think, of course, about the heterogeneity, but these common themes of protecting workers, protecting ability to take sick leave, protecting, thinking about the economy as alongside the pandemic. Those are things that really are essential in all of these communities. And I think we have to think of them collectively, and then think about the issues of trust that in the end come down to very local issues as well. And so I think we have to, at the one time, think of them together, but then also understand the heterogeneity as you're talking about.
Thank you. Zeke, vaccines. It's actually been an area that I find it hard, other than mucking around with the FDA, which I think the pushback has been impressive. It's hard to criticize the Trump administration's approach. Maybe you have critiques, but that's an area where it's not clear to me what the Biden administration will do that's different than Operation Warp Speed. So are there twists on that? And then if Biden's in charge, how do you think the rollout of a vaccine, assuming we have one that works and is approved for the right reasons, how do you think the rollout will look different than it might have looked had Trump stayed in authority?
Well, first of all, I think, getting a vaccine, there's been you can only call a superhuman effort on lots and lots of people's part, from drug companies to the NIH to many others, in terms of academic groups, in terms of trying to identify plausible candidates, get them through preclinical and then clinical testing. And, it will be record speed no matter what. But having a vaccine that's proven sufficiently efficacious to get FDA approval, and at least having some preliminary safety data, we won't have long-term safety data, is only part of the process of getting people immunized. There is, you got to manufacture it in quantity. You've got to finish it, put it in those glass vials, have enough glass vials and stoppers. You actually have to ship it. And in the case of the Pfizer vaccine and maybe some others, we'll need a very good cold chain. There's then local distribution, there's administration. And as Kirsten has reminded us, there's the whole trust issue of, you can get it, you can have people ready, you can throw the party. And if no one actually believes it or doesn't fully trust you, they may not show up. And we won't get to the 70+% of people that we need. And I think each one of those steps is complicated. I think generally in the country, don't have enough visibility into all the steps and all the preparations that have or have not been done to get over the barriers there. Are we going to have enough glass vials? Are we going to have enough syringes and needles? Is that cold chain secure? Now some of that is being done outside the purview of the government. Pfizer is actually putting together its own shipping arrangements separate from McKesson. Do we have enough trained personnel to actually administer this? The communication strategy, nothing suggests that it's in place correctly. So I think there are a lot of hurdles that will have to be addressed that have not been well delineated and managed by this administration that will be different in the new administration. If there's one thing I do know about Joe Biden, having watched and been up close when he administered the Recovery Act, is he does know how to put together a team of very competent people. He does know how to give them the instructions to go, and he is a person who is very practical. Not working, let's refine it, let's change it. There's not doctrinaire in, this is what we're going to do and we're going to stick to it. And so I think that management capacity is going to be very well used to get the vaccine out. So, having the research, having lots of companies that have advanced purchase agreements, so they're funding it. Yes, that has gone reasonably well, but that's only a very small part of what needs to be done to get a vaccine and get it distributed and get herd immunity in the population.
Andy, anything you want to add to the vaccine issue?
No, I think Zeke's done a great job at it.
So we're moving toward the end. I'd love to hear, maybe starting with you, Andy, these sort of cosmic issues of what this all means around empathy and you've characterized part of our problem as the failure of empathy, and not just empathy as in I care about another person, but empathy as in it's not real until I see it.
Right.
So talk about that, and then sort of you and the others, I'd love to sort of end with the issue of expertise in science and what what we've learned over the last year about the challenges that we have in people understanding and acknowledging, respecting science, and how we can possibly get that back. Let me start with the empathy piece.
I think it's the right place for us to have a dialogue as a country. One of the comments I get every once in a while is, well, I don't know anybody that's died from COVID-19. And my response is usually, well, you do, but you don't know their names. These are the people that grow your food. They're the people that are driving your food to the warehouse, the people that work in the store, and maybe you know their first names, but there's a good chance you don't. You probably don't know the people in your jails or in the homeless shelters. And you don't know their parents who live with them. I had a chance to interview a lot of people, including Somali immigrants, who they worked. One guy who I told you about, who worked in an Amazon warehouse, got COVID, couldn't get a test because there were no tests, so they stopped paying him. He had no income. His wife had breast cancer, his son with cerebral palsy, and he basically, because we have no safety net, because we have no paid medical leave, and because these people are far out of sight. And here, many of us, including myself, have enjoyed packages from Amazon. I'm not trying to demonize the company, trying to demonize our society. I'm trying to call attention to this as a societal issue, because we shouldn't let Amazon do that. That shouldn't be their choice. But I don't think many people know that this is kind of what's going on. And so when they say, hey, I can go to a bar, I can do this, I can do that, I'm not worried if I get it, it's just kind of like a bad flu. There's a lot of things that they don't understand along with that this is something that grows exponentially, that if you're a link in a chain, you could very likely be responsible for people dying that you never meet. You never know. 80% of people who get this don't know where they've gotten it from. And so asking people to sacrifice a little bit, to go back to the Churchill point that Zeke's making, sacrifice a little bit for something that they never see, requires a level of compassion, empathy, imagination. Even if you don't have compassion, just use your imagination. I mean, I talked to governors in the southern states when this was going on in New York, telling them and they were telling me how they've done a much better job. And I'm like, you haven't, that's just not how it works. And then I talked to governors in northern states when it was in the South, and they're like, we've done a much better job. I'm like, no, people just aren't going to your state. No one's going to South Dakota. You're not a genius. The virus is staying away. It will come. Yeah. And but then they were talking about not just regular folks, we're talking about political leaders and so there's this, some of it is, again, that just like our inexperience with how this works, how an infectious disease actually works, because it defies intuition. It's one of the problems with having Trump as president is, he thinks his intuition will carry him. And your intuition carries you to all the wrong places. It's why there was a playbook. It's why a playbook was left behind, because there are better answers. It's not possible to get it perfectly right. It is possible to do it with some compassion, some competency, and some experience. And that's not something that, and we missed. And so I think there's a hard conversation to have as a country. It's to Zeke's point about what does freedom mean? If my grandmother would have slapped my face if I would have said, I'm not willing to put on a mask. She went 3 years without coffee. She came here from Ellis Island. She had lived through a 10-year depression. Many people came here in chains, their families. Many people have been here for a long time and suffered a great deal. Many people came from countries where they were escaping violence. And, we're like, 6 weeks of wearing a mask, that's a lot to ask. And that's where we are, just where we are as a country. And if this election tells us anything, we got to face that. We got to face where we are, and we got to start dealing with it.
Yeah, thank you. Kirsten, any reaction to that, or your own thoughts about either empathy or the sort of role of science in our society today?
Well, I'll just reflect on the things that have given me hope during this time, and just call out the work of many of our colleagues and your colleagues at Diane Havlier, Alicia Fernandez, Kim Rhodes. There's a lot of the work that I think that we've done connecting with the communities that have been most affected by this, doing it in a way that that partners with communities, but doing the things that we do well at an academic medical center, provide data, talk about the science, I think has both allowed us to connect with the communities that are most effective, but do it in a way that science is part and parcel with that. Science that has helped actually link to some of the policy changes that have happened in the Bay Area and in California that I think have really protected the same communities. And I think established a level of trustworthiness that we're trying to build as an institution that I hope will serve us well, both as we get to vaccines, continue in the pandemic, but also for many of the other health conditions. And I think that's the opportunity we have if we think differently.
Yeah. Yeah, no, I've been completely struck by that. I just wonder whether it is partly because the bubble that we happen to be in, and that doesn't say that all of San Francisco is privileged, or there aren't poor people, or people or communities that have been ravaged by the virus, but it is to say we start with a level of cooperation and collaboration and a public health department that works really well, and relatively homogeneous political attitudes that probably makes this work easier than it would be in other parts of the country.
I think that might be right. I will say we've had also some very tense conversations with our community partners and reminding us of all of the things we've done wrong as an institution. So it's not always smooth sailing. We have been lucky that we've had good leadership, and we've not been devastated by the pandemic, and that allows us to take all of these steps that I think are necessary. But I think the outcomes that will happen because of the partnerships that I hope will happen will have impacts that will extend far beyond the pandemic. And that's what I'm hopeful about.
Yeah. Zeke, let me give you the last word, sort of big picture stuff. What are the big lessons here, either on Andy's empathy point, the role of science, and how we mend some of these problems? Because some of them just, as Kirsten, I'm glad Kirsten ended on an optimistic note. I try to be that way, but there are parts of this that just leaves me head scratching, like how do we get out of this hole?
Yeah, I do think that it's going to be important for the president-elect to try to build the national sense of community. I think what Andy has pointed out very rightly is, we need to feel like we're part of a community. Our fellow man matters to us, our fellow American. His or her fate is really important to us, and I'm willing to do something to advance it. And I think that's, who Joe Biden is. He is a person who really does care about other people. And I do think that's something that is communicated very directly by him, just in his mannerisms and the way he interacts with people. And I think that will go some distance to try to bring everyone together. And then we're going to have his rhetoric. I know that is, it's about all of us in this together and helping each other out. I do have to say, I am always flabbergasted by the schizophrenia in America about science. And it does point to the need for education and maybe to revitalize what happened in the 50s and 60s about the real emphasis on science education. We love our toys and the science that produced that, right? We really want that vaccine and the science that produced that and the therapeutics that made remdesivir and dexamethasone and all of that. And yet we're suspicious of the expertise of scientists. It's not a coherent picture. And I think we have to make it a much more coherent picture. Now, that time we had the Cold War, we had the space race, which valorized science. And I think we need to take this opportunity to do the same thing around, in that case, it was the physical sciences and engineering. But we need to do that around the biological sciences today and remind people that so much of the great life we have is really a product of this science, and re-educate people about biology, re-educate the country about the importance of science. And I think Joe Biden, he communicates that. These are experts. We're going to defer to the experts. I may not understand how viruses work and massively reproduce in the epidemiology. There are experts for that. I won't be able to interpret the efficacy data coming out of these trials and is it efficacious or not. I defer to experts on the panels, to Tony Fauci, to statisticians. And I think we have to rebuild that confidence. No one's hoodwinking you. We can look at this data and we can explain to you the way it's going. I am very optimistic because I do think these are characteristics, the sense of community, the sense of deference to expertise that Joe Biden exudes.
Well, thank you all. And I love the optimistic note. I've gone from a Fauci 1.7 to maybe a 1.4 in the last hour. Grateful to all three of you for being here with us and for everything you've done in the last 10 months. It's really spectacular. It's making a difference. And let us hope that things continue to or get better as we enter this new era. Thanks so much. Really, really appreciate it.
Thank you. Wonderful opportunity.
Thank you all for being on. A particular thanks to our wonderful production team. You see their names here. They make this conference hum every week. Next week, we'll go back to a regular Department of Medicine grand rounds on a more clinical topic. The week after, we'll do something in COVID, whatever the issues seem to be most interesting to talk about. So I look forward to seeing you all then, and stay sane and stay safe, and see you again soon.